I'm actually the medical director of Oasis Center for Reproductive Medicine, and our flagship center is at Banjara Hills, Hyderabad. And in the last 9 years, we have grown into 9 centers in South India. So we have approximately 5 centers in Hyderabad, and our next centers have been in Vijayawada, Vizag, Warangal, and Chennai. The ethos of the company, or rather what we actually stand for, is ethics and transparency and dissemination of information towards right down to the grassroots level. So this has been the strength. And what we actually focus on other than patient care is also retraining and training of our clinical staff. So that, I think, has been the core strength of the organization as of now. I think it's gathering attention. The attention is there, but I think for it to translate into something tangible, it is going to take some time. But obviously the need is there. We just have to cater to the needs of the society, and how do we make it a bit more accessible, and the most important thing is how do we make it more affordable. So I think these are the two things that need a little bit of work from all sectors of the society, and I think a fertility conclave like this is only going to put good ideas and bring forth some kind of decision making in the future. Well, I'm hoping that the fact that infertility is rising is actually going to bring about a lot of awareness. So once awareness increases, you would see the couple wanting to actually at least understand what treatment options they have, and then comes the access and the affordability issue. So I think one step at a time. At this point in time, we have to start by giving them the information, letting them have the awareness about the issue, the extent of the problems, and what options they have. And then slowly in time, the other target that we have is to see how we can make it a bit more affordable. I don't think accessibility should be that much of an issue, because starting centers is not the point. The point is for it to be actually manageable and viable. So I think once we get to the awareness and the situation, and then we move towards making it a bit more affordable, I think the situation will change. I think focus on what we are doing and what we are best at. And another thing is make it as patient centric as possible, and that, I think, is something that doctors anyway do. Whatever said and done, even though it is called as a fertility industry, they call it as a business model, looking at investors, looking at entrepreneurship. But when we're really looking at the core values, all of us actually as doctors share the same thing, and that is patient-centric approach. And I think that's what is the beauty of this, wherein you have an amalgamation of the ethics, patient care, and the empathy that goes with it, and also make it a viable model. So I think it's interesting.